physical therapy modalities for ankle sprain. Lateral ankle sprains (LAS) account for 10 to 30% of all sports injuries, and are also common in non-athletic populations. Recurrent LAS are common, and evidence suggests that those with previous sprains are twice as likely to have repeated injuries. Many people who have LAS are not adequately rehabilitated to overcome their current injury or to prevent re-injury. In fact, most are not rehabilitated or educated at all. Medical literature supports conservative treatment with early functional rehabilitation for LAS, when compared to control groups. LAS patients who undergo an active supervised rehab program that includes manual therapy techniques demonstrate significantly improved function, reduced pain, and have about a 30% reduction in recurrent sprains. The links below are articles that support these claims. The primary goals of LAS rehabilitation is rapid pain relief, full restoration of range of motion, and proprioception, thereby restoring full activity as soon as possible. I advocate a 4-part rehabilitation program for the treatment of LAS. Phase 1, approximately days 1 to 7, involves relative rest, compression, elevation, and ice. We also begin non-weight-bearing range of motion exercises and walking as tolerated. Phase 2, approximately days 7 to 21, emphasizes restoration of full ankle ROM through appropriate exercises and manual techniques. We transition to weight-bearing exercises during this phase and begin early proprioception and balance exercises. Phase 3, approximately days 21 to 30, emphasizes muscle strength, moderate to high-level proprioception exercises, balance and return to full function, non-athletic. This is generally the final phase of treatment for the non-athlete. Phase 4 of my program emphasizes full return to activity for the athlete. I use sport-specific activities and high-level exercises to ensure the patient is ready for discharge. An individual's progression through these phases is variable. It is my responsibility to ensure each patient is ready before I advance his/her program. I use the lower extremity functional scale (LEFS) to measure the results of my rehab efforts. This is a self-report questionnaire scored from 0, very low function, to 80, very high function. The LAS patients I have treated had an average initial score on the LEFS of 43/80, and the average final LEFS rose to 67/80. The average number of visits to achieve these results was 10. Ankle sprain. I think just about everyone has experienced the pain of a sprained ankle at some time in their lives, most of us more than once. Most people that are active or athletic will experience the pain of a sprained ankle at some point. When I was a medic with a rifle company in the Army National Guard, it was a common injury. When I played football or basketball or even baseball in high school, I suffered a few sprained ankles also. So what exactly is a sprained ankle? According to the micromedics files at the hospital where I work, a sprained ankle is when the ligaments in the ankle are stretched or torn. I had thought that torn ligaments was a separate and more severe injury than a sprain. As a medic with the Army National Guard and as a corpsman in the Navy, as well as a personal trainer, I would still feel that a torn ligament was different and more severe than a sprain. That is, however, what the micromedics says. I do agree, though, that the cause of the sprained ankle or torn ligaments can and often is the exact same. That is, they are both usually caused when there is a sudden injury to your ankle. On the baseball diamond, it could come sliding into base or having your foot turn as you step on base. Just walking down the street, you could slip in a hole and twist the ankle. A football player could have his legs taken out from under him by a tackler and twist the ankle or the knee. Any type of trauma that twists or causes the ankle to bend in an unusual way can cause a sprain. If you do have an ankle injury, you may need x-rays. Do make sure you do not have broken bones. If there are no broken bones, the ankle should heal in about 4 to 6 weeks. Depending on the severity of the sprain, you may have weakness for 6 to 18 months. Though I have had sprains many times, and with proper treatment and therapy even 6 months sounds like a long period unless the ligaments are indeed torn. You will likely experience considerable pain with an ankle sprain, but most caregivers will suggest using Tylenol or another NSAID to relieve the pain. The acronym RICE is usually how a sprain is treated. RICE stands for rest, ice, compression, and elevation. Rest the affected ankle for at least 24 hours if possible. Ice down the area. To help reduce swelling, it is common practice to ice down the area for 15 to 20 minutes each hour for the first 48 hours. Use a bag of ice and place a towel between the ice and the skin. After 48 hours, you may want to use heat, such as warm wet towels in place of the ice. Depending on the severity of the sprain, the caregiver may give you an elastic bandage or a splinter, both to place on the ankle. Follow the direction given, as this may aid in a quicker recovery. You should also elevate the affected ankle above your heart whenever possible. This will help reduce the swelling. By doing these things and following the RICE protocol, you will aid in the healing of your sprain and therefore heal more quickly. Some people believe strongly in the use of supplements and herbs, so below is a short list of a few supplements that have been used in the treatment of ankle sprains. Herbs such as Boswellia serrata, have been used for many years, but it has not had any double-blind studies done on it for effectiveness in ankle sprains. Capsaicin Cream, Capsicum frutescens, can be applied to the ankle injury to help deaden the pain. This is actually made from cayenne pepper and is said to be irritating for the first few applications, then the irritation stops. If you use this, be sure to wash your hands thoroughly to keep any of the substance out of your eyes. Turmeric, curcuma longa, is another herb that has been used for many years but has never had any scientific studies done for effectiveness. Willow, Salix alba, an herb that has been used for many years for ankle sprains but has not been studied in a controlled environment for effectiveness. Supplements such as DMSO, diphenylalanine, glucosamine sulfate, niacinamide, vitamin A and vitamin C have also been used in the treatment of ankle sprains. Acupuncture and acupressure, as well as massage and physical therapy, have all been used in the treatment of ankle sprains.